Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Common disease, tissue salt treatment, part 43, thyroid problems. What is thyroid? In front of throat or neck, just below larynx or voice box, like the shape of a butterfly, lies a small gland called thyroid. Just look at the picture on the right hand side. This is the picture of thyroid, image of thyroid gland. In front stands the thyroid cartilage. Its level is vertebra C5 to T1, that is cervical vertebra 5th, 6th, 7th and T1. This 4 vertebra just lies against this gland on the back side, because vertebrae are on the back side. It's a part of endocrine system of our body. That is, this particular gland is a part and parcel of endocrine system of our body. What are the functions of thyroid gland? Producing T3, T4 hormones. T3 triiodothyronine, T4 tetraiodothyronine. These two hormones producing thyroid performs the following very important task: regulation of the rate of calorie utilization of our body, lowering and increasing heartbeats according to needs, control of body temperature, control the speed of food bolus along the gastrointestinal tract. What are the reasons of thyroid problems? Hyperactivity of thyroid, that is hyperthyroidism, and hypoactivity, that is hypothyroidism of the same, are the chief reasons of thyroid problems. All thyroid problems related to either one of these. What are the reasons of hyperthyroidism? Number 1, Graves' disease, main cause. Nodular goiter. Number 3, thyroiditis, that is inflammation of thyroid. Too much intake of iodine. Much intake of remedies of thyroid disorder. Pituitary tumors, non-cancerous. These are the reasons. Now, what are the signs of hyperthyroidism? Restlessness, nervousness, angry at travels, profuse sweat, anxiety, sleep disorder, fragility of the hair and nails, lowering of body weight, weakness of muscles, increase of appetite, bulging of eyes. There is 3-star. Look at this figure on the right hand side, top. This is the appearance. If you think that this person or this lady is forcefully opening his eyes, not that. It is his normal. It is his normal look. His normal look is this. This is the look of hyperthyroidism. How hyperthyroidism is detected? As a doctor, you must know this thing. High level of T4 hormones and low level of thyroid stimulating hormone in blood confirms hyperthyroidism. That is, if you order for blood exhaustive blood analysis, these two hormones, T4 and TSH, will be measured, and you will see that T4 hormones in high level and TSH hormone in the lower level. That is confirmed that hyperthyroidism. The person is suffering from hyperthyroidism. What are the reasons of hypothyroidism? Radiation therapy, Hashimoto's thyroiditis, a special type of thyroiditis, pituitary gland disorder, hypothalamus disorder, less intake of iodine, thyroiditis, various medicines of modern remedies of allopathic medicine, like remedies of heart, cancer, bipolar disease. Besides, patients of celiac disease, diabetes, lupus, rheumatoid arthritis is to suffer from this ailment. One thing I will just ask you to note, this particular term medicine, these various remedies of modern allopathic medicine. Medicine means it is a science of remedies. Remedy means individual medicine which we use, but medicine as a general, it is a science. That's why we use capital M. Sometimes with the help of small m, we use to denote a particular remedy also, but better while describing medicine, remedy should be something else, means something else, and medicine means something else. Medicine means science. Now, how hypothyroidism is confirmed? The same thing, just the opposite. Low level of T4 and high level of TSH in blood confirms hypothyroidism. You have to remember this as a doctor when you will go through some prescription of a doctor. and or say some pathological report, you have to understand this thing. Now, what are the signs of hypothyroidism? Depression, weak memory, intolerance of cold, tremendous weariness, dry skin, hair, constipation, increased body weight, pain in muscles, joint, too scanty or irregular menstrual discharge, infertility, bradycardia. Bradycardia is lowering of heart rate. This ailment, that is hypothyroidism, causes mental retardation in children. Hypothyroidism is far, far grave compared to hyperthyroidism. Children look puffy, swollen, idiotic look, lack childish go. Some, as a child, he has some normal behavior that will be lacking. Become mentally retarded, too much weight gain, cannot remember anything, suffer from constipation. Let's look at the face of these children. This is the hypothyroidism look, both of them. This is some advanced, it is a starting. How to recognize a child suffering from hypothyroidism? This particular banner I have collected from internet. I have put it here. The symptoms are growth of bones, teeth are maybe stunted. Onset of puberty can be delayed. Hair loss, slow heart rate, weight gain. Baby is constipated, feeling and having feeding problems. Goitrogenic foods and hypothyroidism. That's a very important topic. It has come to light in the modern, after modern study. Lot of naturally occurring foodstuff contain goitrogens. These are called goitrogenic foods. Goitrogens interfere with the function of thyroid and help developing thyroidism, especially in those countries where there are want of enough dietary protein and iodine in foods. About 20 billion people of third world come under this purview. That is, third world countries, in third world countries, about 20 billion people live with less dietary protein and less iodine in food. Trusted study confirms the following foodstuff as goitrogenic: soy, cassava starch, staple starch, cruciferous veggies like broccoli, cabbage, kale, and millet, onion, sweet potato, asparagus, berries, etc. Had there been not enough dietary proteins and iodine in daily foods, above noted foodstuffs should better be avoided altogether. If you do not get enough protein and enough iodine from source outside some outside source, then you must not take this type of food. Better it should be avoided, because these are goitrogenic foods. These will hamper your thyroid function. Now the remedies: calamurin thyroid problem, tongue coated with whitish or greyish matter, enlargement of thyroid gland. It may be tender but not hard to feel. Patient catch cold easily. They cannot tolerate oily, highly processed food, often suffer from diarrhea, constipation, stool whitish. Silicea and thyroid problem, especially for thyroid problems of scrofulous and rachitic persons. Scrofulous means who has got inherited tuberculosis. Rachitic, there are calcium deposition, calcium assimilations or vitamin D assimilation is disturbed. They are too tired. Knees and ankles are too weak. Sweat in extremities. Irritable, excitable, rigid, depressed, timid, hopeless and sad. This is a mental feature of silicea. All troubles aggravate in cold weather, new moon, full moon. But like to take cold foods and drinks and green veggies and fruits. Their trouble aggravate in cold weather, but they like to take cold foods and drinks. Also green veggies and fruits. Netremur in thyroid problem. Thyroid problems of anemic persons. All problem aggravate in morning about 10 to 11 and in sun. Ailments with watering from eyes, salivation with too much thirst. These three things always say part and parcel of netremur. This watering from eyes, salivation, too much thirst. Patient lean, pale, very weak, like to stay alone, depressed, weep but get angry when consoled. Tongue clean with bubbles of saliva, fever blisters on lip. When caught cold, suffer from snuffles and sneezing. Either they crave salt or fully averse to it. Calcarea floor in thyroid problem. Thyroid tumors either stony hard or very soft. skin and tongue full of cracks and fissures. Suspicious mind, depressed, suffer from fear of monetary loss. Suffer from fear of monetary loss is a peculiar mental symptom of calcarea fluor. They are all troubles tend to increase in wet weather and wet places. With this, the video ends. Thanks for listening and viewing. If you feel any problem, write down in the comment section. I will certainly respond.